Hello! Welcome to my channel! And don't forget to subscribe, guys! My topic is all about impact of COVID-19 to the society. But first, let us know what is COVID-19. COVID-19 is an infectious disease caused by a newly discovered coronavirus. Most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatment. Now, let us know how did COVID-19 started. It was believed that it started in Wuhan, China, because one of the market there are selling exotic foods like rats, rabbits, marmots, alligators, and so many more. December 2019, it was reported that there are lots of people having a pneumonia in Wuhan, China. Now, let us move on to the main topic, which is the impact of COVID-19 in the Philippines. The global pandemic has dramatically changed the world. It is visible that indeed it shifted the world into another dimension of normal, or what we call today the new normal. So to give clear examples, it would be best to explain it by specifying one location, and that is the Philippines, and evaluate its impact to different aspects of society. Now, the condition of our economy since the pandemic strikes in our country have a greater impact if we based on GDP, because it has affected the businesses, both small and big businesses. When the country was placed in emergency or state of emergency, sequentially lockdown and many establishments are being closed. Because of that, there are lots of people, not only the establishment's owner, but also the people losing their livelihoods and jobs that cause unemployment. Education. Education is one of the most affected during this time and problematic as well. During the lockdown, the social institutions was being closed as well, both private and public schools, for the safety of the students, teachers, and others. Here are some problems of distance learning. First is internet or data connection. Second is unprepared learning materials. And the third one is shortage of learning materials. Political aspects. Government response. It is the goal of the government to safeguard the people's lives and health security. The government implemented lockdowns. March 12, 2020, it was announced a partial lockdown. It expanded until March 16, 2020. Cash aid. DSWD was responsible for Social Amelioration Program or SAP. It is a subsidy for Filipino people who are being affected by this pandemic. It is a cash assistance from the government to help those who are in needs. Medical supply. We know that we are lacking of medical supplies to be used by the frontliners to secure themselves, just like PPE. And not only that, we are lacking also medical practitioners. Mass testing. We know already how important mass testing is to trace those who are infected so that the virus won't contaminate anymore.